Good afternoon, everyone, and welcome to iMove Physical Therapy's webinar on living your healthiest life. My name is Bill Seiler, and I'm one of the physical therapists on staff. I joined the team about a year ago from Chillicothe, Illinois, which is a small town in central Illinois, and I went to Hope College, played basketball. It's also where I met my wife. Then I did my graduate schooling and received my doctorate from Bradley University in Peoria, Illinois, before living in Peoria for a few years before moving back to Michigan recently. And I'm certified in applied prevention and health promotion, which is really what we're going to be talking about today, this whole concept of preventative healthcare and how we can mitigate our health risk. And what we're finding with physical therapy is so much of the intervention we provide is too little too late in terms of really creating life change for people. And what I mean by that is when someone comes in and they've already have a cardiovascular disease or diabetes or chronic discomfort, we have to ask ourselves, could we have done something sooner? With today's webinar, we are offering a free physical wellness assessment, and we will talk a little bit more about what that is as the presentation goes. But if you're listening to this, please take advantage of this and let us help you find your areas of strengths and weaknesses when it comes to your physical well-being. And so this presentation is coming on the heels of the pandemic, and it's no secret to us that America is struggling with our outcomes with the virus. And this is largely due to what we call modifiable risk factors, things like being overweight, having poor overall fitness, or having any kind of underlying chronic disease that could potentially decrease your likelihood of having a positive outcome. And this is further highlighted in a recent study from October that basically showed that the more fit you are, the less likely you are to experience an adverse event with coronavirus. And so as we go today, we'll be talking quite a bit about this and those modifiable health risk factors, because ultimately our goal is to be as healthy as possible, as long as possible. That's why we're all here. So for those of you who are on the webinar, let's start off with the trivia question here. What is the healthiest city in America? And I'm basing this information upon a well-being index put out by Gallup, and this most recent data is from 2017. And the well-being index evaluated several areas of well-being: purpose, social, financial, community, and physical well-being. Purpose is liking what you do each day and being motivated to achieve your goals. Social is having supportive relationships and love in your life. Financial is managing your economic life to reduce stress and increase security. Community is liking where you live, feeling safe, and having pride in your community. And physical is having good health and enough energy to get things done daily. And so what is the healthiest community out of 190 assessed across the United States? Naples, Florida. Not Grand Rapids, but Naples, Florida. And we have to ask the question, why and how? Because as recently as 2010, Naples ranked 73rd out of 190 communities. And what happened to move Naples forward was this whole idea of what's called a Blue Zones project. And this organization essentially helped the community focus on factors in people's lives that helped reduce health risk. They promoted being physically active, moving naturally, giving access to activities that they could do in the community, such as walking or group fitness, helping people plug into different groups, helping people to eat healthy, and even take a sense of pride in what they're doing in the community. And what they found is that health risk decreased as people followed these ideas and these goals. And variations in wellness scores between cities and state indicate that these locally driven interventions and strategies can be successful at improving the well-being of those who live in the states with low well-being. So you're probably curious, what does Grand Rapids rank? Grand Rapids did pretty well overall, ranking 26th out of 190 communities across the United States. However, when we look at a breakdown of the data, Grand Rapids scored lowest in physical well-being, 69 out of 190. And again, physical well-being is having enough energy to get things done daily. And as a clinic that focuses on fitness and physical well-being, this is an area that we feel like we can really help people. And we have to start to ask ourselves, what can we do to promote moving naturally, to help people find joy in physical activity, or find a community that can help them or help one be more active. And we can do this through these physical wellness assessments and even our fitness offerings that we'll talk about today. So getting into things a little bit deeper here, 3 reasons why your physical well-being is important. We'll be discussing that. 3 reasons why people don't exercise, and 3 ways that we can help you. So again, what is physical well-being? It's loosely defined as having good health and enough energy to get things done daily. And it includes components of cardiovascular fitness, musculoskeletal fitness, balance, mobility, power, or moving quickly, anthropometrics, your body shape and size, diet, and sleep. And this list is by no means all inclusive. Why is it important? Well, physical well-being, as I stated earlier, is associated with risk of preventable disease and mortality. And it's also very expensive to be unhealthy. And we find that people who have better physical well-being have an improved quality of life. Western society anymore has become medically advanced enough to be able to sustain life for really long periods of time. People are living longer, but the data is showing that the quality of life is decreasing in spite of that ability to live long. A lot of this is due to our poor physical well-being. And so what are these risk factors that I'm mentioning? Things like obesity, high stress, lack of sleep, poor cardiovascular health, poor mobility, strength, balance, lifestyle choices we make day to day, such as smoking or excessive alcohol consumption, high blood pressure, diabetes, high cholesterol, and more. And these risk factors contribute to those chronic diseases that contribute to low quality of life. This is a chart that shows self-reported medical conditions, and this is put out by the National Health Interview Survey. And they found that musculoskeletal conditions were the highest reported for male and females, followed by circulatory conditions, then respiratory conditions, followed by diabetes, difficulty seeing, cancer, and hearing trouble. The real shocker with this is that of these 7 conditions presented here, 5 of them are considered preventable disease to an extent. Now, just being alive, you have a little bit of health risk, but when we look at those modifiable health risk factors, we find that each one of those contributes to your risk for musculoskeletal disease or back pain or knee pain, and even all the way up to cancer. Certain cancers are considered preventable as well. The real kicker with this, again, is that 51% of these risk factors are within our control. So this study looked at these behaviors and other factors that contribute to our mortality risk. 20% is hereditary, 19% is environment, 10% is health services, 51% is the decisions that we're making day to day, which says to me that even though there's other factors that contribute to my health is largely in my control and is determined by the decisions I'm making day to day. Another infograph here that's no secret to most, and essentially what it's showing is that the more you sit, the higher your risk for mortality is. The more you move, the less that risk is. When we look at rates of physical activity per week, we find that even just from 0 minutes per week up to just even maybe 80 to 90 minutes a week, you see a significant risk for mortality and healthcare costs. As that activity level continues to increase all the way up to 300 to 500 minutes, you see a really steep decrease in this risk factor. This is also true for cost of healthcare. It's just inversely related. So as your risk factor, or more directly related, as your risk factors go up, your cost or your health risk goes up as well. This is true across the lifespan. So whether you're 19 years old, 75 years old, 90 or 90 years old, the more risk factors you have, the more your healthcare costs are going to be. On the contrary, or on the flip side, as physical well-being improves, you get a reduced risk for dementia, depression, all-cause mortality, risk of high blood pressure, risk of diabetes, reduced pain with osteoarthritis, reduced cost of living, reduced incidence of cardiovascular disease, reduced risk of cancer such as breast cancer, colon cancer, bladder cancer, kidney cancer, reduced anxiety and stress, reduced risk of excessive weight gain, reduced risk of falls, and reduced risk of postpartum depression. As physical well-being improves, you see improvements in cognition, academic performance, quality of life, positive outlook, relationships, physical function, physical literacy, function with osteoarthritis, function with chronic neurological diseases like Parkinson's disease and multiple sclerosis, improved self-esteem, improved sleep quality, improved weight management, increased independence, and reduced overall pain levels. So most people are familiar with all of these statistics and infographics. So why don't people exercise? This is a big question that often comes up in the clinic is, you've come to this point where you're dealing with these chronic conditions or preventable disease. Why didn't you exercise in the first place? I really think it comes down to these three things. First, that exercise is not a priority. The second is that people don't know where to start. Or the third would be that a person has tried and has experienced failed results. This survey conducted by One Poll on reasons people don't exercise found that the excuses were pretty broad. And here's just a few of them. The first is that there's not enough time. Second being the weather's too bad or the weather's too nice. Someone ate too much or it wasn't a priority in their life at that time. Some feel like they're too old or they're too young and they don't need to. They have too much work. They'd rather watch Netflix, et cetera, et cetera. Ultimately, we will use any excuse to not exercise. The current exercise recommendations don't necessarily make that easier for us. They can seem pretty overwhelming. The recommendations for adults is that moderate intense aerobic activity should be 150 to 300 minutes a week or 30 minutes 5 days a week. Or you can use vigorous intensity aerobic activity and exercise 75 to 150 minutes a week. That is on top of the strength training recommendations, which are 2 days a week for all major muscle groups, completing at least one set of 8 to 12 repetitions until fatigue. This isn't even including recommendations with mobility, balance, or speed development as we age. So when people see this, I think they're often overwhelmed and feel like this is an out of reach goal. And one thing I want to remind you is that the recommendations are not the right starting place for everyone. And I use an example of a gym class quite a bit that I'll show you in the next slide, because the things we want to consider here is that is a component called relative intensity, and that's that not everyone is the same. So in a gym class, if you have maybe a 3-sport athlete running sprints next to someone who's been sedentary, you could see a big difference in maybe what looks like effort to some or quality to some, but the person running the sprints and winning may only be working half as hard as someone who's really struggling to complete the sprints because that person's never done it before. That's relative intensity. You have to find the exercise that's right for you relative to your current fitness level and capabilities. The other thing is that exercise is a mile wide and a mile deep, and your style of exercise should reflect your goals. So if you want to be a strong man and lift rocks, well, then your exercise needs to include that. If you want to be able to walk several blocks with your friends, then our exercise needs to shape you to be able to do that. And ultimately, anything is better than nothing. The current health recommendations show that even just 1 minute a week of increased activity has health benefits. So it doesn't take much to start to create that positive change in your life to see these benefits from physical well-being. But ultimately, the combination of not knowing where to start, having a poor relative intensity for your goals, or having low priority leads to failed results. So this is where we can help you. And we call this establishing a health risk profile and then implementing lifestyle intervention. First, that we can identify areas of physical health risk. The second is that we can implement individualized plans to target your needs. And the third is we can empower you with tools and knowledge to improve and maintain your health. A physical well-being screen is a data-backed examination, and researchers have provided ample amounts of data that can evaluate an individual's health that is correlated with injury, mortality, independence, quality of life, performance, and cognitive function. And the 6 areas that we look at here in the clinic include body shape and size, as well as vital signs, cardiovascular fitness, musculoskeletal fitness, balance, mobility, speed, and power. And with these, we can help you establish an appropriate starting point to build on your strengths and target your weaknesses. So a great example I have in the clinic is I've had an individual come in recently who walks very regularly for exercise, and they felt that walking was maybe enough for them. And when we ran them through this physical wellness assessment, we found that cardiovascular fitness was fair overall, but they were neglecting areas of strength, balance, and mobility, the ability to get on and and off the ground was very difficult for this person, and their strength was below age-related norms. And so this person was essentially at a fork in the road where they could continue just walking and maybe seeing the benefits on the cardiovascular side of things, or they could change course and start implementing some of these areas of mobility, strength, and balance into their program and really reduce their health risk as a result. And this applies to older adults as well as it does middle-aged adults, and our tests vary according to someone's current capabilities. And by evaluating each of these areas of physical risk, your health and exercise habits can be more directed to reduce your health risk. And I love to say that you can't have a destination without a map on how to get there. Benjamin Franklin said it best that an ounce of prevention is worth a pound of cure. And our goal is to give you the tools and resources to mitigate health risk by addressing these modifiable health risk factors associated with poor health outcomes, to help build on the strengths, but also to address some of the areas of growth that are showing up in your physical wellness screens. And as I mentioned at the beginning of the presentation here, what we're offering with this is a free physical wellness assessment. And it's with a skilled healthcare professional to look at those 6 areas that I mentioned to help find those areas of strengths and those areas for growth for you in order to reduce your healthcare risk. Some of the other services we offer here at iMove include adult and kid specific fitness classes. So if you're more into the group fitness setting, this could be an option for you. There is some studies out there that show when you surround yourself with healthy people, you tend to become healthier. And when you surround yourself with unhealthy people, you tend to emulate them a little bit more. So surround yourself with a group that is healthy, who's propelling you forward in terms of your health, and the actions will just follow. We also offer personal training, nutrition counseling powered by Precision Nutrition, pain assessments if you have barriers to exercise such as back pain, knee pain, ankle pain, or neck pain. We also offer rehabilitation services and physical therapy. This is just a quick snapshot of our classes and a description of them. Feel free to take a screenshot of this. This is also available on our website. If you have any questions about this, please call us and hear more about our classes and what we specifically offer in each of those. And we are open for questions. If you weren't able to attend the webinar, please reach out, give us a call, and we'll be happy to talk through some of this information